Come in. Hey, doctor.
Hi, Jackson. Thanks for coming in today.
Thanks for having me.
How have you been feeling?
Well, really, it's been like a roller coaster. I've been feeling really fatigued. My back and my neck has been hurting really bad. I've noticed a really gradual weight loss, and I've been craving like weird things like salty foods. I'm really dehydrated. I don't know, it's just a lot.
Yeah, so based off of those symptoms and the symptoms you were presenting with last time you were here for a visit, we ran some tests and we've found out what the cause is.
What's the cause?
Addison's disease.
What's that?
So Addison's disease is an autoimmune disorder where your body attacks your adrenal glands, so those little glands on top of your kidneys.
Okay.
And those glands are responsible for the production of cortisol and aldosterone.
Okay.
So basically what that means is your body now isn't producing enough of those hormones.
Oh. So I'm not gonna die.
No, you're not going to die. They're able to be supplemented. Similar to how diabetes, the pancreas doesn't produce insulin properly, you know, your adrenal glands just don't produce their hormones properly. They can still be supplemented.
Oh.
The life expectancy is still full.
Oh, I see. Oh, so what is Addison's disease caused by?
So Addison's disease is caused by your immune system.
You were too far in frame. That's what I was saying. I see it. Anyway, okay, continue. Ready? So, what is Addison's disease caused by?
So Addison's disease is caused by your immune system mistakenly attacking your adrenal glands, you know, specifically the adrenal cortex. And that's for no apparent reason. So, you know, 75% of cases are just caused by any autoimmune attack, and 25 are caused by other risk factors.
Oh, so do you know why I have it?
So you could have it there could be a number of reasons. There's lots of risk factors, though there's not one specific cause. So it could just be a genetic predisposition to autoimmune diseases. So if you or someone in your family has a history with vitiligo or diabetes, you know, it could just run in the family. Could be cancer. So sometimes if cancer cells, you know, obviously this is not in your case, but sometimes, you know, cancer cells can spread to other parts of your body, and if it goes somewhere near the adrenal glands, it could cause Addison's disease. It could be caused by a number of infections, you know, so if you had a fungal infection spread throughout your body, or sometimes even complications from AIDS. Bleeding in your adrenal gland, so if you've had, you know, abdominal surgery near your adrenal gland, or, you know, blood thinners can sometimes cause it, you know, internal bleeding. There's a number of things that could cause this disease. We don't know specifically what caused it for you. You don't seem to have any of those risk factors, so we'll chalk it up to just the genetic predisposition.
So, wait, how did you guys discover that I had this?
So, Addison's disease, you know, symptoms don't usually appear for this until about 90% of your adrenal cortex is completely destroyed. So you could have had Addison's disease for years and you wouldn't know. And now that your adrenal cortex is so severely damaged, you know, symptoms are starting to present themselves. So when you came into us with some symptoms, we ran some blood tests. You know, they measured your levels of sodium, your potassium, the hormones that are associated with your adrenal gland, you know, the levels of antibodies, you know, that are associated with Addison's disease that would run in your blood if you had it. We did CT scans and MRIs to check your adrenal gland and the areas around it for abnormalities such as, you know, infection or swelling or irritation. We also did
cancer, as you said earlier.
Yes, but as we know, that's not what you have.
Not my case.
You know, we also did an ACTH simulation test, which is where we administer ACTH via a shot, as you may remember. And, you know, your body's level of cortisol, we measure it in response to the shot that we've given you. And, you know, if your cortisol response is lower than normal, that could be a good indicator that you have Addison's disease and you're not producing enough cortisol, because
Oh,
ACTH typically will cause you to release cortisol, but if you have Addison's disease, your body's not going to be able to do that regularly.
oh. Okay. So, what's my prognosis then?
So typically patients diagnosed with Addison's disease are able to live long, full, healthy lifestyles, assuming that they follow their treatment plans very carefully, so you're going to need things such as good exercise and an increased level of salt in your diet. 50% of Addison's disease patients do develop other autoimmune diseases. That's just because typically people who develop Addison's disease in the first place are just predisposed to them, so they're more likely to develop other autoimmune diseases. Older research, so 3 to 11 year lifespan decrease, but we now know that the data from that research, it was all taken from subjects who had other adrenal problems, so not just Addison's disease.
Okay,
so
so
that's
that wasn't
not
a true.
no, it's not
okay.
necessarily linked to just Addison's disease alone.
So, what are my treatments gonna be? Is this gonna be like a lifelong thing? Am I gonna have this for the rest of my life?
So yeah, so Addison's disease is chronic, which means it's uncurable. You will have it for the rest of your life, but luckily it's very treatable. So typically patients start with a number of oral supplements to replace the hormones that your body isn't making. So that's hydrocortisone for the cortisol that your body's not making, and flutocortisone for the aldosterone that your body's not making. So by taking those supplements, it's going to be helping your body replace what your adrenal gland is no longer able to effectively produce.
Oh, okay.
So, you may need to raise this dosage based on any stress factor. So if you're sick for a long amount of time, if you have an infection, if you just had surgery, your stress, since Addison's disease, those hormones are very important for your body's stress response. Addison's disease can have an effect on how your body handles stress. So, if you're under stress like that, you may need to up your dosage. And you'll need to have frequent checkups. So we might need to, raise your dosage, as I said, if you're under stress. And, if you're doing fine, we might need to lower your dosage.
So, what are future treatments, I guess, or anything new that you guys are doing for this disease?
So, yeah, there's a new pulsality therapy, that's been underway to replace some of the oral medications that you might be taking. So basically, it's a pump that would administer your needed hormones, and the pump is gonna release on a timer, so it's gonna more naturally follow the secretion of the hormones that your body will be doing naturally, as opposed to taking them in a pill every so many hours.
Okay.
It's been looking very good so far. Patients who have been on it have noticed a 10% decrease in fatigue and 30% increase in their energy levels first thing in the morning, which is typically when patients with Addison's disease feel their lowest.
So my symptoms that I'm having now are gonna last my whole life?
They'll be significantly lowered, but we can't assure you that you'll get back to 100%, but we can hope for a 99.
Okay.
MRI scans of patients that have been put on this pump for trial have showed a significant decrease in, stress in brain MRI scans, because you can see that on an MRI scan. It showed a significant decrease in that. So it seems to be looking good, and we hope it's...
So what should I look out for with this new disease?
So some patients, can go into what's called an Addison's crisis. So if you're in that, you need medical intervention immediately. It can be life-threatening. So you need to watch for extreme vomiting, loss of consciousness, confusion, severe vomiting and weakness, like I said, fever, and very severe abdominal and lower back pain and leg pain. So if you have any of those symptoms, especially more than one, you need to seek medical attention immediately.
Okay. Thank you very much, Doctor.